Welcome, everyone. We are so excited to be here. On behalf of the Arch National Respite Network and Resource Center, I want to welcome you to the 2022 National Lifespan Respite Conference. For those of you who don't know me, I'm Jill Kagan, I'm Director of Arch, and we are so excited to be able to host this conference with the Respite Care Association of Wisconsin in our first national in-person gathering since 2019. So it's been a long time in coming. And I'm just going to say at the top of this event, I know many of you who were here yesterday are tired of hearing me say this, but we really want to send all of you home well and healthy without COVID. So our policy is masked unless you're eating. So if you have a mask, please put it on. I'll put mine on as soon as I'm done speaking. If you don't have a mask, I believe there are some more at the registration desk. So thank you all so much for your cooperation, and please be safe this week. It has been a long and difficult time for many of us, and we're starting to see that light at the end of the tunnel. But despite the challenges and roadblocks imposed by COVID, there have been many reasons for hope and even some progress. With a new understanding of technologies like Zoom and Facebook Live, we have a new virtual reality that helped us grow our networks during this time. And we extended our reach even more than we had before. During the last 2.5 years, a new awareness of the escalating need of family caregivers emerged, setting the stage for real policy and programmatic change. And we hope that this will help us to elevate family caregiving to a public health issue. Despite the difficult times, the federal government convened both the RAISE Family Caregiving Advisory Council and the Supporting Grandparents Raising Grandchildren Advisory Councils that are expected to release the long-awaited National Family Caregiving Strategy before the end of September, perhaps as early as next week. The Lifespan Respite Care Act and the Older Americans Act, including the National Family Caregiver Support Program, were reauthorized during this time, and funding increases for both programs were realized. Administration policies to help combat COVID, like the American Rescue Plan, provided one-time but significant investments in state actions to build the direct care workforce, to expand respite services and increase flexibility around how respite's provided through self-direction and other methods. Financial support was provided to family caregivers, and education, and much more. So we do have a lot to be thankful for. The most gratifying and long-lasting achievements were accomplished at the state and local levels by our Lifespan Respite grantees and those who work with family caregivers. All of you who got your creative juices flowing and churning and reinvented respite and supports in so many new and creative ways so that they could continue to be a lifeline for these family caregivers during this pandemic when they were more isolated than ever. We still have a really long way to go. We have a direct care workforce crisis. Home and community-based services remain severely underfunded, and paid family leave remains elusive. But we have the opportunity now to build upon COVID, to reimagine respite in ways that are more meaningful, more flexible, and more family-centered, and to engage newly awakened partners like employers, medical and mental health professionals, policymakers, and others who are now more aware of family caregiver needs thanks to all the work that you've done. And this conference provides the perfect space to come together to implement, start thinking about the new National Family Caregiving Strategy and ways that we can work together to implement that national strategy. I know Arch is committed to doing that, and we're going to work with our Lifespan Respite grantees to make sure the national strategy is fully realized. We have an awesome conference planned for you, and we hope that you'll take full advantage of all the great session presentations over the next 2 days. Our nationally recognized keynote speakers will elevate and amplify the work you're all doing at the state and local levels. I want to offer special thanks to Principal Deputy Administrator Allison Barkoff from the Administration for Community Living in the Department of Health and Human Services, who will join us virtually tomorrow, as well as Dr. Jennifer Olson of the Rosalind Carter Institute for Caregivers, who's going to deliver a most timely keynote on working while caregiving tomorrow as well. And her talk will be followed by a panel including members of our own network who are trailblazing to engage employers in caregiver support. And I'm really excited because ARCH is going to also honor outstanding respite services from across the country that we've recognized as innovative and exemplary in 2022. And I was looking forward to our live radio show. Today, you'll hear a little bit more about that, and we're still going to proceed with some of that. But the focus of that will be on how to reach underserved and diverse family caregivers with culturally competent respite services. And ARCH is also dedicating to doing more work in this area in the coming years. Most importantly, I want to thank our amazing conference co-hosts, the Respite Care Association of Wisconsin. Absolutely. Please. This event absolutely would not have happened without their extremely generous donation of resources, time, and staff support. And I especially want to thank this wonderful woman to my right here, Lisa Schneider, who's transformed respite in the state of Wisconsin, and her amazing team here, who not only spent more than 2 years planning, fundraising, and organizing the International Short Break Conference last year that we wound up having to hold virtually in collaboration with us, but then they voluntarily stepped forward to do it all again for the national conference. I can't say enough how grateful we are. And so much of so much of what they're doing here in Wisconsin is really cutting edge. They're serving as a model for all of our other lifespan respite programs across the country in more ways than one. And I also want to thank Dr. Kim Whitmore from Marquette University. Unfortunately, she's not well today and cannot be with us, but she works with ARCH on so many levels, and I would really be remiss if I didn't thank her. She heads up our Respite Research Initiative. She's heading up the evaluation of our Respite Provider Training Initiative. And on top of all that, she has volunteered to serve as our conference nurse. So I think you can still call her, even as she's at home, if you're in need of knowing where to get a test or where to get treatment. And of course, I want to thank Badger Bay, our conference logistics manager, who have taken care of every detail of this conference so that we didn't have to worry about it. And that's really just been amazing and wonderful. And also, I want to thank the National Conference Planning Committee. We rely on a national team to help us put this together. Again, without their help and their support and their guidance, we wouldn't have a national conference at all. That really comes from our grassroots network. Members of the National Committee include ARCH network members, state respite coalition members, lifespan respite grantees, and others, and their names are listed in the conference program. So if you're a National Planning Committee member, just raise your hand so you can be acknowledged. I know most of them are here. Don't be shy. Thank you all. And then thanks wouldn't be complete without recognition of our extremely supportive colleagues at the Administration for Community Living, Lori Stahlbaum and Greg Link, who oversee the Lifespan Respite Care Program and are always our champions for respite at every turn. And unfortunately, they were not able to travel to this event either, but they're here with us in spirit. And finally, I want to thank all of our very generous sponsors, including Marquette University College of Nursing, Elevance Health, the International Short Break Association, the John A. Hartford Foundation, and the Wisconsin Department of Health Services, GT Independence, Lakeland Care, CARF, and many others. All of the sponsors are listed in the conference program. We really hope that the learning and networking experiences that are to come for you over the next 2 days will energize and motivate you to reimagine all the new ways that we can support family caregivers and you can keep up your good work. Let's take what we learn here and turn it into collective action that makes high quality and meaningful respite more available. Not just at home where you live, but working with Arch to make it true across the country. Thank you all very much. Have a very fantastic conference. We've waited a long time to get here, and we want to make sure that it's the best it can be. So thank you all so much for traveling to be with us this week.
Well, thank you so much, Jill. We're also equally as thrilled to have you here and your team, Cassandra and Mary Jo. You guys have been great to work with and are always so supportive of our CAW and all the Lifespan grantees. So we really do truly appreciate what you do. As a co-host of the conference, I'm happy to say welcome to Wisconsin. We are hosting this conference in one of the best cities in Wisconsin, and we're in the capital of Wisconsin, Madison. The hotel is only located about a block away from the Capitol building, which is modeled after the National Capitol building. So I encourage you guys to get out and take a look. There's a beautiful square with a lot of great restaurants and shops and stuff like that. But to just take a look at the Capitol building, you'll see the resemblance, and it's really a beautiful building. Speaking of Wisconsin, did you know that we were one of the first three states that served as models for the federal Lifespan Respite Program, having been established by state law? So we're one of the first ones that actually have a state statute that funds respite care programming. So we're very thankful for that. And we recently, I think we got like $250,000 for 20 years. And we recently got a bump maybe 3 or 4 years ago to getting an annual amount of $350,000. And that is our core. We always work for programming that is not going to go beyond what we can sustain. And thanks to the state of Wisconsin, we do have a core batch of funding that serves as match for our federal lifespan grants. Most recently, though, we were very happy that DHS and RCAW were awarded a 5-year federal lifespan respite grant. We're very excited about that. I want to thank Lynn Gall, who is here. Thank you, Lynn. Lynn is my new, if any of you are not a state agency and you have to work with your DHS department, sometimes you get tossed around like a hot potato, and sometimes you find home, and we have found our home. So I'm so grateful for Lynn and the department that she works in. So we do have a great conference planned for you guys. We have had to do a little punting with some changes that came up at the last minute. I'm gonna encourage you all to check out the exhibit hall, as we have got some great vendors and local artists that I'm sure you'll find amazing. We have a group that's coming from Artworking, and it's an organization that champions persons with intellectual and developmental disabilities who have their own businesses and create a myriad of things. So some of it's jewelry, some of it's art, some of it's note cards, and they're going to be available in the exhibit hall along with the other vendors that we have. So I encourage you guys to make sure you go check out the exhibit hall. I will say planning this conference takes a village on the national, state, and local level. Just like to reiterate what Jill said, that I really want to be thankful to Badger Bay, who really served as our professional conference planner, and many, many thanks to Isabel and Eric. Those guys truly rock. I'd also like to extend my personal thanks to Jill Kagan, who is a champion for all state lifespan respite grantees. I feel like she's our own personal champion, but she really is. Same for all the lifespan grantees. So she just adds that little touch that just makes it like she's got your back all the time. And poor Kim, she can't be here today, who has been such a staple in trying to plan this conference, but she is home ill and will not be able to make it. Kim and I, she's a professor with the School of Nursing with University of Marquette. She actually worked with Secretary Timberlake on some things, so Kim has a very well-established reputation. But she also serves as a resource for us to make sure and evaluate the programs that we're implementing, because we really want them to be evidence-based or evidence-informed. And Kim is always happy to step up to the plate to do that. To bring things home, I would be remiss to not mention that I have the best board of directors. And I'm not just saying that because some of them are in the audience here. They are my mentors. They get the people that get the foot in the door, that cracks it open so I can go in and talk to people. They're our biggest cheerleaders. They're ambassadors for RCAW and always, always have my back. I want to just thank them and staff for supporting me and all the things that we do. We did blow up RCAW about 4 years ago and completely revamped it. And we just had such great support from the state and with my board of directors that we were just very fortunate to be able to do that. And we made a significant impact in doing so. And last but not least, I want to extend my sincere love, appreciation, respect, gratitude, and awe to our team at RCAW. Their work ethic, passion, drive, and empathy are off the charts. Rachel, Val, Leslie, Margie, I know you're standing up. Where are the rest of you guys? Because Les is way in the back. I don't know where Margie. They're just the best to work with and all overachievers and always feel guilty that they're not doing enough. So, as Jill mentioned earlier, the theme of this conference is Reimagine Respite. It's meant to be timely and inspirational. The pandemic may be going on, but we can now imagine a more hopeful future. COVID-19 casted a harsh light on the lack of support for family caregivers, but it also presented opportunities to raise awareness and to rethink traditional supports to ensure that they are more meaningful for family caregivers and their loved ones. This conference will provide a space to dream big, explore new ideas, create different ways to achieve respite. It will also inspire us to build on what we've learned and discover new ways to meet the respite needs of the nation's more than 50 million family caregivers. With that being said, I'm so excited to introduce our next speaker. Wisconsin Governor Tony Evers appointed Karen Timberlake the Secretary of the Wisconsin Department of Health Services in January 2021. She previously held the position from 2008 to 2010. She leads one of the largest, most diverse state agencies in Wisconsin with an annual budget of about $15 million and more than 6,000 employees. The mission of the State Department of Health Services is to promote and protect the health and safety of the people in Wisconsin. DHS works to advance this mission through statewide leadership in public health, mental health, and substance use services, Medicaid, and health and safety regulatory oversight. Please welcome Secretary Timberlake.
Thank you so much, Lisa, and good morning, everybody. I am delighted to add my welcome to Lisa's. We're going to do a little audience participation real quick. It'll be easy, I promise. Are any of you visiting Madison for the first time? Hey, look at all those wonderful people. And are any of you Madison natives or feel like you know Madison pretty well? All right, look around. So all you new visitors, you need to find those folks. Let me add just a couple of other specific suggestions to Lisa's. First, absolutely do please take a walk around the Capitol Square whenever you have a chance to do that. Today is Wednesday, I do believe. And on Wednesdays, starting kind of plus or minus now and going until about 1 o'clock, there's a little mini farmers market on the Martin Luther King section of one of those sort of spokes that runs into the Capitol Square. So take a stroll and go check out the vendors. There'll be cheese curds and baked goods and flowers if you want to bring those back to your rooms. It's really delightful. In addition, not during any of the important conference content, but just like when you have a minute. In addition, I really do commend a walk just right through the middle of the Capitol. It is a building that is open to the public. Walk into the rotunda, look up at the amazing ceilings and frescoes. There's 17 kinds of marble in the state capitol, real number. It's really worth your time. And finally, I would not be doing my job as the state health secretary if I did not note that there is also a Walgreens on the Capitol Square. I happen to know that they are giving the updated COVID booster because I got mine on Sunday. And go to vaccines.gov if you would like to register to get your updated booster while you're here. So that's it. That's all my tour guide and all my housekeeping. Really, I am delighted to be here. I know my colleague Lynn and others from the Department of Health Services are delighted to be here and to really welcome this important discussion to the state of Wisconsin. When I think about just what my own past 2 years have been like, since returning to the department a year ago, January, obviously we have had a lot of focus on COVID-19 in the state health department, although I do like to remind myself, as well as others, that we are not, in fact, the Department of COVID, and we do other things. So some of those other things, though, have really included thinking about the kind of ongoing and future effects of COVID and the disruptions in everyone's daily lives and patterns and routines and support networks that we all have come to rely upon. I know that we are spending a lot of time as an agency really focusing on mental health and well-being across the lifespan and with as many kind of specific focuses as we can possibly bring to bear. And in this case, and for all of you, I really think about the mental health and well-being of care providers, of those of you who are that infrastructure support for those care providers. This has been, to put it mildly, a challenging couple of years, and I am just as delighted as Jill and Lisa are that you all are back, in person and able to really draw that energy and draw that support from one another. I also know that we have this kind of consistent refrain going now in Wisconsin, and I'm sure in many other states, around where are the workers? Where did everyone go? And in fact, my 17-year-old daughter, we were chatting about a version of this challenge the other day. She works at Olive Garden, and she was talking about how Olive Garden is having trouble, staying staffed. And she said to me, where did everybody go? And I said that, that is a question that lots of people are being paid to spend their days thinking about. And so recognizing that, the workforce that you are supporting is certainly in large part the unpaid caregiving workforce, as well as the paid supports that work in sort of tandem with that unpaid workforce. We have a huge challenge in front of us to make sure that everyone who can be in the paid or the unpaid workforce has the opportunity to have the support and the care and the services that they need to get that work done. And so I really do commend the work that you all are doing to create that respite. Last thing I'll note before I just touch on a few of the kind of exciting, we hope, public policy developments and other programmatic developments happening in the state. In my own personal life, I have seen for my parents an sort of immediate drop into the deep end of the caregiving pool for my mom on behalf of my dad. And I know that everyone who kind of goes through that as in their own family lives experiences it the same way, but I will not ever forget visiting with a group of caregivers for people whose partners had developed dementia, which is not my dad's situation, but still it's kind of comparable. And these caregivers said to me, they used the metaphor of, it's as if you're packing for this long-planned journey. Some of you may have heard this or have used this analogy yourselves. And you've planned this trip to Italy, and you're so excited, and you're all ready, and you've made all the arrangements and booked the hotels and packed the right clothes, and you get on the plane and you get off the plane, and you are in Antarctica. And you have none of the right clothes, and you have none of the right plans, and you don't know where you are, and you don't know who to turn to for help. Right? And so, and that's picking the example of the kind of, I'm going to call it maybe involuntary or sudden shift to caregiving, which is not everyone's experience, right? Some people come to this very much as a choice, and it is a passion, and it is a mission. But I really do think about that, and I think about our need collectively, you as advocates and care providers and experts in the field, and us as funders and program administrators and hopefully policymakers, more on that in a second, we really do need to be working together just all along that continuum of whether this is life's work and passion or something that really sort of occurred almost in the blink of an eye. That is a whole continuum of need and a whole continuum of opportunity. So I also would be remiss if I didn't give a special shout out as well to Lisa Schneider, and also to Stephanie Birmingham, who's a member of the Respite Care Association of Wisconsin Board of Directors, who both served on a task force that was appointed by Governor Tony Evers to really focus on caregiving. And speaking of being just a little bit ahead of the curve, the governor convened that group shortly after taking office, and they just wrapped up their work in early 2021. And what I would note, especially given that this is a national conference, is really the purpose of that task force was to focus on some policy change that needs to be made in Wisconsin, both things that we as an executive agency and as the governor's administration can do, and things that we need our partners in the legislature to do. And I'll just touch briefly on a couple of things that we couldn't manage to get across the finish line with our legislature. And if any of these are things that you've accomplished in your state, we would love to hear how you did it, because clearly we need maybe a different approach to making the case. So one of the things we wanted to do was really just pilot an evidence-based care management protocol that would support family members who are providing care to adults of any age with chronic and acute health conditions. Couldn't quite persuade the legislature of that one. We had some proposed amendments to the Wisconsin Family Medical Leave Act that would have included chronic conditions and caregiving responsibilities as reasons to use FMLA. We would have expanded the list of people who are covered to include grandparents, grandchildren, and siblings. Couldn't quite persuade folks of that either. The one that surprises me the most is we also would like Wisconsin to join the 42 other states represented in this room that have adopted the CARE Act, which does require people who are being discharged from the hospital that their caregivers have a complete set of discharge instructions. And so we're one of, again, 8 states in the country that hasn't seen our way fit to adopt that piece of legislation. So would welcome your advice on how we get that done in this upcoming legislative session. The good news, though, and Jill did touch on a little bit of this, we are a state that for many, many years, thanks to strong executive and legislative bipartisan support over many administrations, has really invested in our home and community-based services infrastructure. And so when our dear friend and supporter, Senator Tammy Baldwin, who you'll hear from in a second, and some of her colleagues in Congress adopted the American Rescue Plan Act, many of you know that there were enormous investments in home and community-based services as a part of the American Rescue Plan Act, as Jill noted. It is also true that those investments are of one-time money. And so we do, as a state, and really every state needs to be thinking hard about how we invest those dollars to build infrastructure that can be sustained in other ways, or to do other things with that money that is appropriate for one-time investment. But I do want to lift up just a couple of things that we are doing with those resources that we're very excited about that I think will be of interest to this broader audience. So in Wisconsin, again, for many years, predates me for sure, we have been fortunate to have a network of what we call aging and disability resource centers, which are really those information and referral hubs that are available in every community across our state. We also have 11 federally recognized tribal nations in Wisconsin, and in each of those tribal nations, we have staff who are dedicated to providing that information and referral set of services. That said, Wisconsin's a large-ish state, a lot of windshield time in some parts of our state, and it's not super convenient, depending on where you are, particularly in one of our more rural counties, to get to the brick and mortar physical ADRC. In addition, we got some really important feedback from another council that the governor set up that we helped to staff, the Governor's Health Equity Council, where folks said, thanks so much, DHS, for all these great aging and disability resource centers. You don't know who you aren't serving. You know who's walking in the door, but you don't know what you don't know about who doesn't know about you, who doesn't trust you, who doesn't feel like they themselves and their culture and their particular needs are well represented in the work that you do. Great feedback and great point. And so as part of what we're doing with those home and community-based services dollars, we will be both building out an online network and an online portal, online set of resources to make those ADRCs a bit more virtual, recognizing that won't, work for everyone, but it'll be kind of a complement to what we're doing. In addition, we've got some very specific plans for more focused outreach and education so that we can really be reaching out into communities that we are not currently serving today. We also are going to use some of our HCBS funds to support a really exciting independent living supports pilot. So as the state's Medicaid agency, one of the things that we know is that people end up relying on the Medicaid agency sometimes because of a lack of really a very modest intervention at just the right time that could have kept them living independently in their home, in their community, with the right supports, paid and unpaid. And yet, from a Medicaid standpoint, right, and particularly in home and community-based services, we have to wait until folks are at pretty close to an institutional level of care before we can spend $1 on them. Well, that doesn't make any sense. And so with some creative work by our team and thankfully some really good support from CMS, we are going to be investing some of those HCBS funds in this independent living supports pilot, where we're going to look to be investing in people who are starting to show limitations in one or more activities of daily living, and where just a modest investment at just the right time can maintain that independence for as long as folks, would like to see it maintained, including one of my favorite initiatives will be a little bit of financial counseling, right, to help individuals and families really think about how to navigate those increasing care needs, those increasing expenses that do come really for all of us. So you are in Wisconsin at an interesting time with a lot going on. Tomorrow, actually, we will be introducing, all state agencies will be submitting sort of the first next chess piece in the next biennial budget cycle. Little sneak preview, you might see something about Medicaid expansion in that proposal for us tomorrow, because once again, we are one of 12 states that hasn't yet seen fit to expand Medicaid. So more to come on that. And this is really, kind of the kickoff of that next policy making season in Wisconsin once we get through the fall elections and then our new legislature is seated in January. So for those of you who are here from other states, we will really benefit from your best ideas, your best thinking about the important ways that public policy can support the work that you all are doing here locally and that we are doing here locally. We welcome your advice, we welcome your feedback, and we're just so pleased to have you in Wisconsin. So with that, I will turn things back over to Lisa and have just a wonderful conference. Thank you so much.
Thank you, Secretary Timberlake, for your time with us today. Really appreciate it. Right now, I'm really happy to announce that Senator Tammy Baldwin has created a video for us. She couldn't be here in person, and you all hopefully have heard of her because she plays a key role in the funding that we get at the national level. So Senator Tammy Baldwin was first elected to the Senate in 2012 and re-elected in 2018. Prior to her time in the Senate, Senator Baldwin served 7 terms in the House of Representatives. Senator Baldwin shattered the state's glass ceiling by becoming the Wisconsin's first female member of Congress and the nation's first openly gay senator. Since she was first elected, Senator Baldwin has been committed to increasing access to quality, affordable home, palliative, and hospice care services, and has worked to fund vital respite programs and resources to improve the quality of care for our families, friends, and our neighbors. So I'd like to share with you a video from Senator Baldwin.
Hello, I'm Senator Tammy Baldwin, and I'm thrilled to welcome this year's National Lifespan Respite Conference to the great state of Wisconsin. We are glad to have so many family caregivers, care recipients, and care providers from across the country gathered once again in the Badger State. I also want to recognize the co-hosts of this year's conference, Jill Kagan and Lisa Schneider, for all your hard work putting this event together and for your dedication to serving the caregiving community. Every day, family caregivers in Wisconsin and across our country tend to the needs of their loved ones. And though this work can be incredibly rewarding, it can also be physically and emotionally taxing. For the past 2 years, our caregivers have been on the front lines of the COVID-19 pandemic, tirelessly caring for our loved ones. And while doing so, caregivers have faced multiple challenges, working long hours, providing uncompensated care, and lacking adequate respite services. While COVID-19 has increased the burdens that caregivers face, the pandemic has shed light on the essential need for respite services. Respite care helps address the mental stress and physical health issues that come with the 24/7 job of caregiving. I understand the importance of supporting the health and well-being of our nation's caregivers. I am proud to have worked across the aisle to introduce the bipartisan Lifespan Respite Care Reauthorization Act to extend and fund the Lifespan Respite Care Program. This legislation will work to support our caregivers by authorizing $10 million annually to provide grants to states to establish or enhance respite resources. I'm proud that this critical legislation ensures that our caregivers will receive the quality and accessible respite services that they deserve. As we continue to battle the pandemic and reimagine respite in a post-COVID world, we must keep investing in these vital programs that serve our communities. I want to extend a big thank you to each and every one of you for the incredible work you do to support our families and care for our nation's more than 50 million family caregivers. I'm happy to be a partner with the Arch National Respite Network and Resource Center and the Respite Care Association of Wisconsin in this journey to care for our caregivers. Together, we can help make a difference by reimagining respite.
So excited to get that video.